I think every man at one point or another in their life will experience some form of erectile dysfunction. You know, the common answer was always from the doctors, well, just take a Viagra, take a Cialis, but that's not exactly the answer. It's a band-aid to the problem. When a patient is dealing with erectile dysfunction, he's affected not just in the bedroom, and his confidence level at work is affected by it. The locker room talk, when people start talking about sexual activities, he's got his head down because he knows he can't perform well, so he's trying to get away from the conversation. That affects a man. That affects a man at work, that affects a man when he comes home to his spouse. It affects him his overall life. The first aspect is just sitting down with the patient, talking to them, and trying to figure out, is this a psychological issue that he's dealing with? Is this caused by medication he may be taking, or just health conditions that may cause this? Patients age 18 years old come to us with erectile dysfunction all the way up to middle-aged men, and everybody's different. My biggest obstacle is to make him feel comfortable so the patient opens up and talks about what's going on. It's a very sensitive subject. Most guys that come here are very, in a shell. They're scared to say something wrong. They're scared to that they're being judged. So the most important thing is to make the patient feel at home and make him feel that obviously this is not something that he's the only person that's dealing with this. That's the one thing that I hope people that are watching this video will get from this, that they're not the only one, and this is a very common problem, and it can affect men at all ages and any time in their life. I don't care if you're married for 10 years and very comfortable with your spouse. It doesn't mean that you're immune to erectile dysfunction. It can still affect you. At one point or another, I think most men will deal with some form of erectile dysfunction. The most important thing is that you don't just sit at home and pretend this issue is not happening. Call today, come in. Least of all, you'll learn a lot about yourself and about how erectile dysfunction happened, period.